Which chamber of the heart has thicker muscular walls? Right atrium, left atrium, right ventricle, left ventricle. The correct answer is option D, left ventricle. Which ECG lead is commonly used to monitor myocardial infarction? Lead 1, lead 2, lead 3, lead AVR. The correct answer is option B, lead 2. Which of the following is a short-term mechanism for regulating blood pressure? Renin-angiotensin system, vasopressin release, baroreceptor reflex, aldosterone secretion. The correct answer is option C, baroreceptor reflex. For blood clotting, fibrinogen is changed into fibrin with the help of thrombin, platelets, vitamin K, antithrombin. The correct answer is option A, thrombin. Which component in the blood acts as an anticoagulant? Fibrinogen, thrombin, globulin, heparin. The correct answer is option D, heparin. What is the normal pH value of human blood? 7.4, 7.2, 7.8, 6.6. The correct answer is option A. 7.4 is the normal pH value of human blood. Which structure is responsible for distributing electrical impulses throughout the heart? Pulmonary veins, atrioventricular AV node, Purkinje fibers, none of the above. The correct answer is option D, Purkinje fibers. Which of the following is the largest artery in the human body? Coronary arteries, pulmonary artery, aorta, none of the above. The correct answer is option C. Aorta is the largest artery in the human body. Which of the following minerals ions play the main role in blood clotting? Magnesium, sodium, calcium, potassium. The correct answer is option C. Calcium mineral ions play the main role in blood clotting. The condition where fatty deposits build up in the arteries and restrict blood flow is called hypertension, atherosclerosis, arrhythmia, ischemia. The correct answer is option B, atherosclerosis. The splenic artery is a branch of superior mesenteric artery, renal artery, inferior mesenteric artery, celiac trunk. The correct answer is option D. The splenic artery is a branch of celiac trunk. Which of the following hormones play a key role in long-term regulation of blood pressure? Adrenaline, insulin, aldosterone, glucagon. The correct answer is option C, aldosterone. What is the main function of red blood cells in the cardiovascular system? Fighting infection, filtering waste products, initiating blood clotting, carrying oxygen. The correct answer is option D, carrying oxygen. Which vessel carries oxygenated blood away from the heart to the rest of the body? Aorta, pulmonary artery, pulmonary vein, vena cava. The correct answer is option A, aorta. A winded QRS complex on an ECG can indicate atrial fibrillation, ventricular fibrillation, atrioventricular block, sinus bradycardia. The correct answer is option C. A winded QRS complex on an ECG can indicate atrioventricular block. The term hypertension refers to low blood pressure, normal blood pressure, high blood pressure, irregular heart rate. The correct answer is option C. The term hypertension refers to high blood pressure. What is the medical term for a pinched or compressed artery due to plaque buildup? Angina, atherosclerosis, embolism, none of these. The correct answer is option D. Angina. Which valve prevents the backflow of blood from the aorta into the left ventricle? Mitral valve, tricuspid valve, aortic valve, pulmonary valve. The correct answer is option C. Aortic valve. Which chamber of the heart receives oxygen-rich blood from the lungs? Right atrium, left atrium, right ventricle, left ventricle. The correct answer is option B. Left atrium. Which chamber of the heart pumps oxygenated blood to the rest of the body? Right atrium, left atrium, right ventricle, left ventricle. The correct answer is option D. Left ventricle chamber of the heart pumps oxygenated blood to the rest of the body. What is the name of the condition where there is a blockage in one or more of the coronary arteries? Myocardial infarction, angina pectoris, atherosclerosis, cardiac tamponade. The correct answer is option A. Myocardial infarction. Which of the following factors can increase the risk of developing deep vein thrombosis? Prolonged immobility, regular exercise, low blood pressure, high fiber diet. The correct answer is option A. Prolonged immobility. Which valve separates the right atrium from the right ventricle? Mitral valve, tricuspid valve, aortic valve, pulmonary valve. The correct answer is option B. Tricuspid valve. Which vessel supply oxygenated blood directly to the heart muscles? Coronary arteries, coronary veins, aorta, pulmonary arteries. The correct answer is option A. Coronary arteries. The medical term for a rapid, irregular and ineffective heart rhythm is called ventricular fibrillation, atrial flutter, ventricular tachycardia, sinus bradycardia. The correct answer is option A. The medical term for a rapid, irregular and ineffective heart rhythm is called ventricular fibrillation. Which type of blood vessel has the thinnest wall, facilitating exchange of gases, nutrients and waste between blood and tissues? Arteries, veins, capillaries, venules. The correct answer is option C. Capillaries. Coronary arteries originate from which major blood vessel? Aorta, pulmonary artery, vena cava, coronary sinus. The correct answer is option A. Coronary arteries originates from aorta. The medical term for a condition characterized by inflammation of the pericardium is myocarditis, endocarditis, pericarditis, none of these. The correct answer is option C. The medical term for a condition characterized by inflammation of the pericardium is called pericarditis. Where is the sinoatrial SA node located in the heart? Right atrium, left atrium, right ventricle, left ventricle. The correct answer is option A. The sinoatrial SA node is located in the right atrium of the heart. Which of the following is a mechanism used by the body to decrease blood pressure? Increase heart rate, constriction of blood vessel, release of renin, vasodilation. The correct answer is option D. Vasodilation. Which teeth are used for crushing and grinding of food? canine, incisor, canine and incisor, premolar and molar. The correct answer is option D. Premolar and molar teeth are used for crushing and grinding of food. Which of the following is a bleeding disorder? Leukemia, anemia, hemophilia, leukopenia. The correct answer is option C. Hemophilia is a bleeding disorder. Bartholin's gland is present in vagina, uterus, ovary, cervix. The correct answer is option A. Bartholin's gland is present in vagina. The average blood loss in a normal menstrual cycle is 200 to 250 ml, 50 to 100 ml, 100 to 150 ml, 150 to 200 ml. The correct answer is option B. The average blood loss in a normal menstrual cycle is about 50 to 100 ml. During clotting, the prothrombin is changed to thrombin in the presence of calcium ions and fibrinogen, thromboplastin and vitamin K, calcium ion and vitamin K, calcium ion and thromboplastin. The correct answer is option B. During clotting, the prothrombin is changed to thrombin in the presence of thromboplastin and vitamin K. The longest portion in the fallopian tube is the interstitial, ampullary portion, the infundibular, none of these. The correct answer is option B. The longest portion in the fallopian tube is ampullary portion. Thrombocytopenia stands for weakness of platelets aggregation, reduced platelet count, increased platelet count, normal platelet count. The correct answer is option B. Thrombocytopenia stands for reduced platelet count. The middle portion of the human sperm contains nucleus, proteins, centriole, mitochondria. The correct answer is option D. The middle portion of the human sperm contains mitochondria. A decreased bone density is called osteoporosis, osteomyelitis, joint stiffness, arthritis. The correct answer is option A. A decreased bone density is called osteoporosis. Hair color in human turn white due to absence of which of the following pigments? Melanin, melatonin, bilirubin, none of these. The correct answer is option A. Hair color in human turn white due to absence of melanin pigments. Which enzyme helps in pet digestion? Amylase, lipase, pepsin, trypsin. The correct answer is option B. Lipase enzyme helps in fat digestion. Heartbeat originates from the papillary muscles, SA node, AV node, Purkinje fibers. The correct answer is option B. Heartbeat originates from the SA node. The main product of routine metabolism is iodine, urea, carbohydrate, glycogen. The correct answer is option B. The main product of routine metabolism is urea. Thyroid is effective only in the presence of calcium, iodine, potassium, sodium chloride. The correct answer is option D. Thyroid is effective only in the presence of iodine. Which of the following fat act as an endocrine gland after ovulation? Graphene follicle, stroma, germinal epithelium, none of the above. The correct answer is option A. Graphene follicle fat act as an endocrine gland after ovulation. The rate of drug absorption is greatest in the large intestine, stomach, gallbladder, small intestine. The correct answer is option D. The rate of drug absorption is greatest in the small intestine. In human body, glycogen is mainly stored in the thyroid gland, liver, kidney, intestine. The correct answer is option B. In human body, glycogen is mainly stored in the liver. The most reliable indicator of neurological function in a patient is level of consciousness, EEG, vital signs, MRI. The correct answer is option A. The most reliable indicator of neurological function in a patient is level of consciousness. Which of the following is present on the surface of intestinal epithelial cells? Phagocytic vesicles, phagocytic vesicle, microvilli, none of these. The correct answer is option C. Microvilli is present on the surface of intestinal cell epithelial cells. The following are the function of kidney except formation of erythropoietin, formation of urea, maintaining of water balance, maintaining acid balance. The correct answer is option B. Formation of urea. The maximum amount of urea is present in dorsal aorta, hepatic vein, renal vein, hepatic portal vein. The correct answer is option B. The maximum amount of urea is present in hepatic vein. The balancing organ of the ear is tympanic membrane, vestibular apparatus, tectoral membrane, cochlea. The correct answer is option B. The balancing organ of the ear is vestibular apparatus. T cell mature in thymus, liver, spleen, kidney. The correct answer is option A. T cell mature in thymus. Which of the following hormone is not secreted by posterior pituitary gland? Growth hormone, oxytocin, ADH, estrogen. The correct answer is option D. Growth hormone is not secreted by posterior pituitary gland. The phi wave on the electrocardiogram corresponds to arterial depolarization, arterial repolarization, ventricle depolarization, ventricle repolarization. The correct answer is option A. Arterial depolarization. Who coined the term cell? Swan, Schleiden, Robert Hooke, none of these. The correct answer is option C. Robert Hooke coined the term cell. Which organelle is responsible for producing energy in the cell? Golgi apparatus, nucleus, mitochondria, endoplasmic reticulum. The correct answer is option C. Mitochondria organelle is responsible for producing energy in the cell. Which organelle is responsible for detoxifying harmful substances in the cell? Golgi apparatus, endoplasmic reticulum, lysosome, peroxisome. The correct answer is option D. Peroxisome organelle is responsible for detoxifying harmful substances in the cell. Which of the following cells release insulin when glucose levels elevate in the body? Gamma cells, beta cells, alpha cells, zeta cells. The correct answer is option B. Beta cells release insulin when glucose levels elevate in the body. Food substances are digested with the help of enzymes that are present in mitochondria, Golgi complex, lysosomes, ribosome. The correct answer is option C. Food substances are digested with the help of enzymes that are present in lysosomes. Which of the following cell organelles is called a suicidal bag? Lysosomes, Golgi bodies, cell membrane, mitochondria. The correct answer is option A. Lysosome cell organelles is called a suicidal bag. Which of the following is known as the powerhouse of a cell? Mitochondria, cytoplasm, lysosome, nuclei. The correct answer is option A. Mitochondria is known as the powerhouse of a cell. Cell membranes are mainly composed of sugar and proteins, lipids and proteins, starch and lipids, sugar and lipids. The correct answer is option B. Cell membranes are mainly composed of lipids and proteins. Which phase of the cell cycle involves the actual division of the cell into two daughter cells? G1 phase, S phase, G2 phase, M phase. The correct answer is option D. M phase of the cell cycle involves the actual division of the cell into two daughter cells. Which structure is responsible for maintaining cell shape and providing support? Microtubules, microfilaments, intermediate filaments, centrioles. The correct answer is option C. Intermediate filament structure is responsible for maintaining cell shape and providing support. Which organelle is responsible for maintaining intracellular pH and regulating ion concentrations in the cell? Golgi apparatus, endoplasmic reticulum, lysosome, vacuole. The correct answer is option D. Vacuole organelle is responsible for maintaining intracellular pH and regulating ion concentrations in the cell. The Golgi complex is responsible for transporting, modifying and packaging DNA, RNA, protein and lipids, none of them. The correct answer is option C. The Golgi complex is responsible for transporting, modifying and packaging proteins and lipids. Which cellular structure is responsible for maintaining cell shape and providing mechanical support? Cell membrane, cytoskeleton, Golgi apparatus, nucleus. The correct answer is option B. Cytoskeleton cellular structure is responsible for maintaining cell shape and providing mechanical support. Which of the following is involved in the synthesis of phospholipids? Mitochondria, cytoplasm, endoplasmic reticulum, smooth endoplasmic reticulum. The correct answer is option D. Smooth endoplasmic reticulum is involved in the synthesis of phospholipids. Which phase of the cell cycle involves the actual division of the cytoplasm? G1 phase, S phase, G2 phase, cytokinesis. The correct answer is option D. Cytokinesis phase of the cell cycle involves the actual division of the cytoplasm. What is the process by which cells engulf large particles or droplets from their surroundings? Endocytosis, exocytosis, phagocytosis, phagocytosis. The correct answer is option C. Phagocytosis is the process by which cells engulf large particles or droplets from their surroundings. Which of the following cell organelles are sites of protein synthesis? Ribosomes, lysosomes, mitochondria, Golgi complex. The correct answer is option A. Ribosome cell organelle are sites of protein synthesis. Which of the following cell organelles is absent in animal cells and present in a plant cell? Cell wall, cytoplasm, vacuoles, mitochondria. The correct answer is option A. Cell wall cell organelles is absent in animal cells and present in a plant cell. Which cellular process involves the programmed cell death for the removal of damaged or unnecessary cells? Apoptosis, mitosis, meiosis, cytokinesis. The correct answer is option A. Apoptosis cellular process involves the programmed cell death for the removal of damaged or unnecessary cells. Which cell organelle is responsible for storing genetic information? Ribosome, mitochondria, nucleus, chloroplast. The correct answer is option C. Nucleus cell organelle is responsible for storing genetic information. What is the role of spindle fibers during meiosis? Chromosomes condensation, movement of chromosomes, DNA replication, protein synthesis. The correct answer is option B. Movement of chromosomes is the role of spindle fibers during meiosis. Which of the following is a single membrane bound cell organelle? Vacuole, Golgi apparatus, endoplasmic reticulum, all of these. The correct answer is option D, all of these. In Golgi apparatus, the maturing pace is biconcave, convex, spherical, concave. The correct answer is option D. In Golgi apparatus, the maturing pace is concave. Spherical or tubular membranes which separate the material present in endoplasmic reticulum from that of cytoplasmic material are called cytosol, cisternae, folisomes, cristae. The correct answer is option B, cisternae. Who opposed the idea the cell is an empty space bounded by a thick wall? Rudolf Virchow, Swan, Robert Brown, none of these. The correct answer is option C. Robert Brown opposed the idea the cell is an empty space bounded by the thick wall. Who first observed and thus hypothesized that new cells are formed from the previously existing living cell? Swan in Sweden, Rudolf Virchow, Louis Pasteur, both B and C. The correct answer is option B, Rudolf Virchow.